Every journey to mobility has a beginning, and sometimes it starts in an unexpected place. Before reclaiming her stride, our patient first faced a challenge with her shoulder, taking her first step into the world of joint replacement. That experience didn't just restore movements, but it built the confidence to take on a far bigger battle, which was chronic knee pain. Today, we explore her inspiring transition from hesitation to healing and the science that made it possible. Joining us is Mrs. Kavita Bopat, a retired high school English and geography teacher, brought up in Chennai and educated at University of Madras, married to an Indian Army officer. She is a proud mother of two accomplished children. Having settled in Pune since 1989, she dedicated years to teaching at various prestigious organizations and continues to inspire by coaching students and homemakers in spoken English. A lover of books, crosswords, and Sudoku puzzles, she lives by a simple yet very powerful mantra: take life as it comes with a smile and live in gratitude.
Namaskar, I am Kavita Bopat. I'm a teacher, retired teacher who had worked for the past 30 years. I have a passion for teaching. I've been, even now, I continue teaching students who want to learn English. Mostly it's a conversational English classes which I conduct. And this passion, I have also a passion for other things like music, and I like to meet friends, travel. And today I'm here with Sahyadri Talks, Health Talks, Sahyadri Health Talks. I want to share my experiences regarding my shoulder surgery and my knee replacement. About me as such, I'm blessed with two children, a daughter and a son. And I have a granddaughter who is also a doctor in the field of medicine. I'm proud of that. After 55 or so, then I started realizing that there is some problem in my knees, I could squat on the floor and get up easily, but then after that, I found difficulty in getting up. I had to take the support of something after a few years, and I showed it to a doctor. He said, Badla. Kai badla? I said, Kai badlu? Gudge badla mane.
Used to go for a walk. Then gradually my mother started telling me that Bapat Kaku is not coming for walk. Why? Is because of the knee pain.
So walking pattern
That is one thing which very frequently gets affected.
I started wobbling, sort of like a ship, moving. So becoming normal. My daughter told me, now you check your bucket list. Now tell me what all you want to do. I said, I want to travel. So she booked my tickets. And I went on a solo trip to Ayodhya, Lucknow, Allahabad.
Oh, lovely.
And with the Veena Travels. And I was happy.
Also joining us is Dr. Abhijit Agashe, a leading orthopedic surgeon from Deccan Gymkhana, Pune, renowned for his expertise in joint replacement, arthroscopy, complex trauma care. A pioneer of direct anterior approach of hip replacement in the region, he has performed over 400 plus successful procedures with faster recovery and excellent functional outcomes. He marked a milestone by performing Maharashtra's first ankle replacement surgery in 2012 and the first direct anterior robotic hip replacement in his city in 2023. With advanced international training and a strong focus on precision-driven patient-centric care, he is widely trusted for managing complex orthopedic conditions. At Sahyadri Hospitals, he continues to blend innovation with surgical excellence to deliver outstanding patient outcomes. Let's begin this conversation. Hello and welcome to Sahyadri Health Talks, a platform where we understand the medical world in a little simpler way. We listen to stories of real healing, real experiences and real struggles. This is Dr. Tushita. Joining me today is a very special guest whose mantra in life is take life as it comes with a smile. And the smile definitely lights up the room. Welcoming Mrs. Kavita Bopat. Hello ma'am, namaste. How are you?
Namaste. I'm good, fine. How are you?
I'm good. Welcome on Sahyadri Health Talks.
I'm also happy.
We are extremely delighted to have you. Also joining us is the expert behind this healing. He's just not a known name when it comes to joint replacement, but is an architect of second chances. Welcoming Dr. Abhijit Agashe. Hello sir, how are you?
Hello Dr. Tushita, I'm fine.
Welcome back on Sahyadri Health Talks.
Thanks for having me on Sahyadri Health Talks.
Welcome back. So I welcome both of you today on this interesting conversation, and we are going to talk about ma'am's journey on which started with shoulder replacement, I believe, and then on the knee replacement.
Okay.
But before I get in there, when I spoke to her, I understood that you both know each other from quite some time. So how long is it that you know each other?
I think we shifted into their building somewhere in 2010.
Acha.
So from then I've been familiar with them. His mother and myself were very good friends. We are still good friends.
Oh, best friends.
She's our neighbor, was our neighbor for almost 10 years
Acha.
before we actually went ahead and did her knees. So she and my mother used to go together for a walk, have a chit chat.
We used to go for a laughter club and all that. You know?
Small club in the building.
Acha.
So she is more like my mother rather than
Maushi.
just Maushi. Correct.
Vasi.
So
And senior Dr. Agashe was also very, like he used to come and talk. He used to be very friendly with my husband and he used to have long talks.
Acha. So it's more kind
of a family bonding together.
Family bonding together. Beautiful. So what I understood is before her bilateral knee replacement, you underwent for a shoulder replacement. What were the symptoms? Like how did you land up getting a shoulder?
I had no problem at all with my shoulder.
Acha.
I had to take the decision of getting surgery done because I had a fall in the parking area. In our building parking. It was a very minor fall, but the impact was so much. I fell on my right shoulder and the impact was so much that the shoulder ball got fractured. And we got the x-ray done and doctor suggested that there should be immediate surgery.
Okay.
So
there was no symptoms. You just landed up there. So what are the symptoms? What are the conditions in which we reach out for you take a decision for intervention rather than a conservative management?
See, quite often I think when she underwent a surgery for her shoulder, she was nearing 70.
Achha.
So that's a similar story for many patients that they say that the fall was not very high velocity. So they just have a fall after while walking or in the bathroom. So primarily it's a low velocity trauma where it's not a road traffic accident.
Yes.
It is because of a very weak bones that they have. And then there is a condition called as a 4-part fracture, which is a very specific condition in the shoulder, where the shoulder ball and the area around the shoulder gets fractured so much that it is into pieces. Now there are ways of treating it. If it is a younger patient who is nearing 50, the first choice would be to fix that fracture back into place with plates, screws and sutures. But the chances of failure are very high. So a patient who is 50 and if it fails, he has a chance of getting a surgery done again. But a patient who is nearing 70 wants a single stop solution. Yes. As I said in the first part of our discussion that she is more like my Masi rather than just a patient. And for anyone who is nearing 70, I would not like that patient to go for a second surgery. So the first surgery should be the last surgery. And in that case, a patient who has a 4-part fracture where the ball is also cracked and there is a split in the shoulder ball, the best answer is to go ahead and do a reverse shoulder replacement, which is comparatively a much bigger surgery, but the recovery is much way too faster. There is no second surgery required and the patients are back to their normal shoulder movement within say around 1.5 to 2 months time.
So ma'am, what was your first reaction when he told you, right, that okay, Masi, this needs a surgery? So when he said that, so what was you were expecting it to land up in a surgery?
When there's a fracture, I know there has to be some operation and all that. But then I wanted to be fit now again. So naturally I said, go ahead.
Go ahead.
But I came to know later that my original shoulder ball will be replaced by a metallic one.
Achha.
Then I said, okay, on the Women's Day I had a fall.
And then you became an iron woman.
Yes, then I became an iron lady.
Iron lady.
Iron ball.
So help us explain, understand that what is this reverse shoulder replacement?
See, normally speaking, the shoulder is a ball and socket joint where the socket is attached to the central part of your body called as scapula and the ball is on the arm bone which is called as humerus. So when you get a fracture, to keep things in place, you also need a few muscles which are called as rotator cuff. Now, when it's a multi-fragmentary fracture or a 4-part fracture, these muscles are also torn to a large extent. Also, they are disrupted from the bone. So, keep it in place, it is impossible to keep it in place. So, what you do is reverse the biomechanics. The ball goes on the central part or the scapula, and the cup comes on the shoulder part or the humeral part. Thereby, requiring these 3 muscles, which are called rotator cuff, is no more required. Plus, patients who are nearing 70, a lot of them might have undergone some sort of a rotator cuff injury. The viewers might be having, a few of them might be having that surgery done, where your rotator cuff is torn. And in 70s, the chances that your rotator cuff would be really good, like someone who is at 50, are very low. So, replacing with a regular ball, you are destined to fail. So, you change the biomechanics in such a way that even if your rotator cuff is not good, you don't need that rotator cuff to get your shoulder movement back to normalcy. And that's where you go ahead and do a reverse shoulder.
So, ma'am, how was this experience during the surgery and post-surgery? How was your overall experience during
Of course, during the surgery, painkillers are there, so I did not experience any pain. But later on, of course, the painkillers were also administered, so it was good. I was admitted in the hospital. After coming home, then my hand, there was no plaster as such.
Yes.
My hand was in the sling.
Yes.
So I had to keep it in the sling for 15 days according to doctor's instruction.
And it must be very difficult for
Yes,
you
very
considering the
difficult.
background
And
which you
after
come
15
from.
days, I was allowed to put it down for some time,
Yes.
Then the physiotherapist also visited and got the exercises done. Then I went for a follow-up. After that, doctor told me that now you'll be fit. You won't even remember that you had a fracture. So of course the physiotherapy, I think Dr. Mahajani used to come
Correct.
for physiotherapy.
Achha.
And for nearly 20 minutes every day we had the exercise routine.
Sessions.
And my hand, she made it sure that I would be able to do my daily task without much of handicap. But of course this shoulder, I can't lift it up like the left one, normal one. But that's okay. It doesn't hamper my activities.
Correct. So that's the difference in a reverse shoulder or probably a surgery done for fractures vis-a-vis surgery done for an osteoarthritic knee. Initial days of your recovery is going to be slower because you have a fracture primarily. It is not a degenerative condition where other tissues are normal. Here the tissues are traumatized, your muscles are torn. So you need to give some time for these things
Entire
to
unit
heal
to
first.
heal
Correct.
completely.
So as she said, for first 15 days we had immobilized her in a sling. The only exercise allowed was a pendulum exercise. Then later on we started getting her shoulder to move a little more. And I think reverse shoulder patients get around 70 to 80% of their function back. Yes, overhead abduction like this is not something to be done. But
it's not recommended.
It's not recommended. Right? But how many activities do you really do with the hand going right up there, particularly at an age of somewhere around 70?
Yes,
even if you are able to do 80% of your work without pain, I think that is a big boon.
Yes.
Rather than trying for getting it back into place, going ahead for a failure and doing the same surgery later on.
Yes.
So primary reverse shoulder for a 4-part fracture nearing 70-75 is the best way to go ahead.
To go ahead. Now that was about the shoulder, surgery which you underwent.
Yeah.
But after that, you also had a knee replacement surgery.
Yes.
And what I understood from the conversations that we had was ki your knee was troubling you from quite a long time before even the shoulder, there was a fracture in the shoulder. So, but you are a teacher.
Yeah.
And your routine involved long hours of standing and being very active. So how did you manage during that time, and how did you finally decided कि नहीं अब तो करना पड़ेगा?
Of course, in the teaching profession, I was there in the for nearly 30 years. And as you know, it requires a lot of standing job.
Yes.
But I also had varicose problems.
Achha.
That was inherited. My mother also had that. So I was under the impression that because of the varicose, I am having some pain.
So you really didn't understand when the knee thing started because of the varicose thing which was already there.
So I didn't. I just took it in my stride, and then it was not so painful. I could climb the stairs. We had a 4-storied building, a school. Sometimes the lift was never working, so we had to climb the stairs, get down the stairs. So nothing hampered my activities. But just before I retired, maybe somewhere at the age after 55 or so. Then I started realizing that there is some problem in my knees, like I could squat on the floor and get up easily, but then after that, I found difficulty in getting up. I had to take the support of something, and then that made me think that something is wrong. And then I got my X-ray done after a few years, and I showed it to doctor. He said, "Badla, काय badla?" I said, "काय बदलू? गुडघे बदला म्हणे."
Godigi badla. So, what are the most common symptoms that you see in such aging patients?
See, arthritis has stages.
Yes.
So, in the early stages of arthritis, the patients are able to do almost all activities. The activities are painful after doing them. So, it is not like that they are not able to do it. So, truly speaking, can we stop progression of arthritis? The answer is no. But yes, if it is identified in the early stage, we can probably retard the progression of the disease. And as the arthritis stage progresses, it goes to advanced stage arthritis. You will not be able to do a certain activities, number one. And almost all activities start becoming painful, and you start experiencing pain on your daily routines also. Majority of the times, a few painkillers here and there might give you pain relief for a few weeks. But as the disease keeps on progressing, the painkillers also stop working. So that's how arthritis usually goes. And as Kaku said, it started probably at somewhere around 55, and I think she got operated when she was 71. So that's a long time that has gone. It's almost 16 years.
So the regression,
before.
I think it was going on inside, and he wanted it to be timely done. But then I didn't think that it was very necessary. Then someone, maybe a layman in this,
Yeah, there was another problem. Kaka was not well at home.
Yes, other priorities were there, like
she had to take care of him.
Aged
so she
parents.
was postponing it for quite a long time. She was due for a knee replacement for almost 3 years before we actually did it. But yes, in the initial phase, it can be very easily treated conservatively if it is treated in the correct time frame.
So, ma'am, you already knew that. I mean, as Sir says that you already knew that you have to undergo this, and he kept on reminding you that every minute. I mean, every time that he saw you, right? So, during this phase, what progression of symptoms, or what worsening of your daily activities, hampering your daily activities, did you see?
That's what the pain increased.
Pain increased.
And then I could not go for longer walks. And sitting and getting up from the sitting position, that was also a bit difficult. So that I found was hampering my activities, But still, as I said, I was postponing it because I had other priorities.
Yeah, I think like every
woman,
working woman, where
you put your own problem at the back seat.
Yes.
And your family, your elder members and everyone, that becomes a priority. Okay. And my husband had undergone a bypass surgery also in 2008, soon after my retirement. So he needed a lot of care. And so I was there to look after him, and I couldn't afford to lay in the bed with my surgery, But then in 2018 I had the shoulder accident. So after that, then I said now I can, because my husband, we appointed one attendant to look after him.
Achha.
So this option was also there. So then later on, even I started telling my daughter also, like we'll go in for the knee surgery, Then because attendant will look after my husband.
So you had to go through a shoulder surgery to realize that you can go for a knee surgery as well.
I thought was the correct time is when my mother and she used to go for a walk. Then gradually my mother started telling me that Bapat Kaku is not coming for a walk. Why? Is because of the knee pain. And maybe around 3 to 4 months she was reluctant to go for a walk because of pain. She was walking, but not to the tune that she used to walk.
Yes.
So my mother and she used to walk for almost 5-6 kilometers in the morning for a morning walk. And gradually she started dropping down or skipping the days. And that was the time when I think she realized that now it's beyond conservative treatment.
My gait also, walking pattern
that is one thing which very frequently gets affected.
I started wobbling, sort of like a ship, moving.
So they start doing a duck walk. So that's the classical, we call it as a duck
and
walk.
that was noticeable. People notice it, that you're walking like a duck, like duck walking.
So what were the home remedies or anything that you tried during this period? What were the other remedies that you tried? Did you try anything else?
I was trying all these ointments, then keeping a pillow under the leg. So all this I was doing. But then finally in 2020, my husband passed away
Acha.
in January. And after that, after a couple of months, I said, even my daughter, she said that let's now, now you look, concentrate on, focus on yourself now. Let's get your knee surgery done. I was okay with that.
So that was the turning point that you opted
Yes.
for a permanent
After
solution.
I was free from my responsibilities. And then, of course, the COVID set in, the corona period. So at that time, the hospitals were busy attending to
The COVID patients, yeah.
So this, all this fracture, not fracture, all these things have surgeries.
What we call it as elective
Elective
surgeries.
There was no
yeah.
urgency about that.
Yes, yes, yes.
So again, that got postponed. You know. Then 21, things are becoming normal, and at that time, I decided to get the surgery done.
So, sir, as you said, right, that you started hearing it from your mother that, ma'am is not coming for the walk. So, what are the typical findings which you see in patients, which ultimately leads them to, undergo a surgery?
See, not only her, I have seen these patients for last 20-25 years.
Yes.
Majority of them in the early phase are in denial. Most of them will say that I don't have pain. The first thing is they say I don't have pain. They don't have pain when they are resting, but the minute they start activities, they get pain, and the easiest way for them to get pain relief is don't do the activities.
Yes.
That's
Avoid that.
Correct.
Avoid.
So when a patient comes to me and I see a X-ray which says it's a grade 4 arthritis and there is bone on bone disease, the first thing that I ask them is how many minutes do you walk, or how much kilometers do you walk, or can you walk? Then they say, no, I don't walk much. I am just doing my household activities and that's all.
घर के अंदर I'm
बस
walking.
उतना ही करूँगा, उससे ज़्यादा नहीं कर सकता हूँ. And that is where they understand that okay, I am pain free because I am not doing anything.
Doing anything, right?
And once they undergo knee replacement after the first few months of their recovery, when they come back to me, they say, doctor, now I am walking 3 to 5 kilometers a day without any pain. A few of my patients have climbed Girnar thing, almost 10,000 steps. And then it's a life-changing surgery, and they understand that okay, the pain was not there prior to surgery because there was no activity. And as I keep on telling all my patients is, majority of them are in such phase of their lives where they are done with their responsibilities. Fortunately, they are financially well off, where they can enjoy their lives. And only because of your knees, you are not able to do
restricting
that.
yourself. Correct.
So after a knee replacement, go for some nice trip, go somewhere out, see the world, enjoy yourself more, rather than just screaming, though I don't want to do that, and then hiding behind the idea that I don't have a pain because I am not doing any activity.
Yeah,
That's the commonest thing that I see.
Commonest thing
Very
that
common.
we see.
Even happened in my case also. I used to reduce my activities, and then it was okay. Then I said, where's the need to go in further? But then we don't realize, we laymen don't realize that the regression is going on inside. And then there'll be a time when there is, you can't do anything, you have to go in for surgery. So it's better to do it earlier.
Yeah. So did you have any fears? I mean, I know you already underwent a surgery under him. So did you have any fears, particularly about the knee replacement before going the surgery?
No, because this robotics and all this, all this new technology, I read and I heard that it's very painless, less of pain, not much of thing. So I said surgeries, and once you place faith in your doctor, once you trust his directions, then everything becomes easy.
So that is one thing which he kept on mentioning about you,
Yes.
that when a patient has complete trust on the doctor and faith in the procedure, then the healing automatically becomes very fast. Half the battle is won. So how do you manage patients who come with a lot of apprehension, anxiety? And what I understand is typically the most common anxiety and point of fear in such patients is that अभी तो मैं फिर भी चल रही हूँ, बाद में अगर चल नहीं पाई तो.
Correct.
So how do you handle such patients?
See, I started my practice in 2004-2005. Internet was not that rampantly available that time, so the questions that used to come that time were different than the questions that
Comes now.
This particular question, will I be able to walk, is truly speaking not that common now.
Acha.
So majority of them know. We have so many patients who have undergone surgery, and they have seen at least a couple of patients who have undergone surgery and are doing well. but with Google and now with the other AI tools
AI
that are
tools.
available. So people have different questions. The first question nowadays comes, will there be any complications?
Acha. So straight away jumping to
Straight away
complications.
One thing that our viewers, all of us should understand, that there is no surgery in the world without complications.
True.
There is a rate of complications. There is a share of complication in every surgery. Even in knee replacement, there are chances of complications. We can minimize the complications with a lot of new technologies, pre-operatively investigating them perfectly well. But even with the best possible done in the best of the world setups in the world, in the best of the hands, there will be some amount of complications. And if your doctor, if I am true to the patient that yes, these are the possible complications, these things can go wrong, we will try and avoid all of them. So be true to your patients. Don't tell their lies that okay, no, 100%
Don't be
there is
false
guarantee.
hopes,
Correct.
basically.
So there are chances of complications, and if something goes wrong, I will be there to help you out. But yes, we will try and avoid all those complications. But these are the complications, maybe around 0.5% or 2%, up to 2% possibility, and you have to tell them upfront that yes, these are the possible things, and this can go wrong. We will try and avoid them, but ultimately there will be a few possibilities. And in my experience, what I have seen is, if you are true to your patients, they believe you that okay, you have not given them a promise of the sky.
Yeah.
You have given them idea that these things can go wrong. These are the possibilities. If this can be done together, or we have to stagger them and do it in
So
stages.
basically, transparency and
Yeah.
clear communication is what is required
Absolutely.
from both the sides, is what I believe. So, ma'am, you had already undergone shoulder replacement under him. Then you underwent a knee replacement.
Yes.
So, did that help you in the process of going for a surgery? कि मतलब पहले एक बार already आप करवा चुके हो in doctor के also I mean, if I totally take away the angle that you knew him personally, but apart from that, did your apprehension and fear and all that reduce, or how was it
Yes,
when you went for the
definitely.
second
Because
surgery?
I had this experience of the shoulder surgery, and it was a success. Within 2 years, I was really back on
Back
my
in
this
normal,
normal.
हाँ.
So I said, no, there's no problem. This surgery also will bring me back to normal.
So
And,
there comes the confidence.
Correct.
that confidence is very, and that's the thing, like I am a Sai Bhakta.
Achha.
And Sai Baba's dictum is Shraddha aur Saburi. So Shraddha is the first thing. Like Shraddha, भगवान में श्रद्धा रखो, खुद पे श्रद्धा रखो, and most important अपने डॉक्टर पे श्रद्धा रखो. So have faith in your doctor, and then patient. You know why we call patient? You have to be patient.
Patient.
That patience is very important. That's what makes a patient. So you can't expect a magic wand, like.
Yes.
So everything takes its own time. The surgery,
And
the
falls in its
healing,
own
and the
place.
exercises to come back to the normal. You can't just hurry up things.
True, very true. How difficult was it for you, sir? Operating on somebody with whom you are emotionally attached.
That's a very common question that I get.
Because most of the times, it's a very common thing that they say that surgeons don't operate on their families or
Correct,
family
correct.
friends.
So fortunately, I inherited that from my father.
Acha.
So I had operated on my mother also for some surgery.
Oh my God.
So see, you have to have compartmentalization in your brain. The minute you are out of your consulting room, out of your operating theatre,
Haan.
then she is my Masi.
Haan.
But when she is in the consulting room, when she is on the operating table, she is a patient. I am a doctor. I am going to do my job as a doctor. So if that compartmentalization is possible in your own mindset, then only you should operate on someone you know or in your family. But fortunately, in our training, we are trained in that way that the minute you go into that role, you forget everything else. You are a doctor, you are treating a patient, you are treating a symptom or a disease. And then the minute that emotion comes in, that during the surgery, if one of the steps goes not the way I want, and the emotion plays a role, then my hand is going to tremble.
Shiva, yes.
Correct. So fortunately, I inherited that from my father. So when I go to that role, I forget everything else, and I'm operating as a surgeon only. From recovery point of view, again remains the same. As a knee replacement is not, as she said, it's not a magic wand.
Yes.
Surgery is just the 50% of it.
Yeah, the
So the
remaining
rest
is the
50% comes after the rehab part, and in the rehab part, you have to be a little tough. Again, when you are going to be tough, emotions don't play any role here. So as I keep on telling all my patients is, when you go for rehab, you have to call a physiotherapist that you don't know. It has to be a person with
is a
whom you are
stranger.
not familiar. So that's familiarity definitely plays a big role, but it can play a big role in a negative way also. So if you can compartmentalize, it is better. Otherwise, you preferably stay away from that.
So I'm coming to the rehabilitation part of it, which is the post-surgery. And as Sir also said that, surgery is just the 50% of the healing. Remaining 50% totally depends on you and your mental state and the physio, because rehabilitations, to be honest, are painful during the initial phase.
Very true.
So what kept you driving throughout this rehabilitation process, and what were it, how did you sail through this?
That because I knew very well, I had seen a few patients, heard about few patients who did not do the physiotherapy religiously.
Acha.
So after the surgery is done, that is the main task of the doctor, the skill of the doctor, everything. But the physiotherapy is very important in the case of knee replacement.
Knee replacement.
Because unless you follow the physiotherapy religiously, you can never get totally cured, completely. At 99% you will get cured. If you are lazy and if you avoid physiotherapy, then there's going to be a lot of pain, lot of discomfort, and then the whole patient, they start blaming the doctor.
Yes.
कि उन्होंने अच्छा नहीं किया. It's
अभी
not
भी
that.
दर्द
The doctors are doing their best, but the follow-up, like what the patient has to do, that is very, very important. So this is my thing. I would like to tell patients that once you get एकदा ऑपरेशन झालं की तुम्ही स्वतः तुमचं एक्सरसाइज आणि फिजिओथेरपी रेग्युलरली करायलाच पाहिजे. अजिबात कंटाळ करायचं नाही. इफ यू आर लेझी, इफ यू अवॉइड इट, देन फिनिश. इवन टुडे in a way that's a good thing, because of the physiotherapy, automatically you get into the habit of doing exercise.
Acha. So it becomes a part of your routine.
It becomes now every morning I get up in the morning and for 1 hour I am doing all my exercises.
Lovely.
So even at the age of 77 I feel that yes, I am fit.
Pre-operative counseling also plays a very important role. I get a patients who have done their surgery somewhere outside and they are not happy with their knees. And when I discuss with them, I realize that they have been promised sky before surgery. So it is primarily very important to educate your patients that yes, the first few weeks to few months of surgery are going to be painful. It is not a magic wand that you've done surgery today and from tomorrow you are back to normal. See, it is a process of recovery which is going to last around 3 months. The first 3 weeks is going to be the highest painful part. But if you do not do your exercises in those first 3 months, then the surgery is likely to fail. The chances are surgery are likely to fail. Second important part is I see a lot of patients, we divide them into a category called as walkers and non-walkers.
Acha.
So those patients who were not walking prior to surgery at all do not do so well post surgery because I cannot change your muscles, I can change your joints.
Yes.
So the muscles, the strength of their muscles has to be built by yourself. You cannot ask someone to come and do it. The physiotherapist can come and help you.
Yes.
Ultimately, it is you who will have to do it. So, pre-operative counseling, that yes, you will need physiotherapy. It is going to be some amount of pain in the first few weeks of your surgery, up to few months of your surgery. But once you are done with your physiotherapy, well, if your knee surgery has gone well, then there will be no pain and you will be back to normalcy. So, it is the pre-operative counseling which I think plays the majority of the roles. You have to set the ideas into your patient's mind that yes, this is something that I need to do. They have to understand that yes, there is going to be some amount of pain post surgery, and this pain over a period of time will go down and ultimately vanish. But if they expect that okay, from tomorrow I am not going to get any pain, and you start physiotherapy and that's painful, then it impacts negatively on their mindset.
True.
So the pre-operative counseling plays a major role.
So as you said, the pre-operative counseling, so you are explaining the patient about the entire process, right?
Yes.
So now you have explained, gone in depth about post-surgical transparency, informing the patient that what is the ground reality and all that stuff. What part I want you to explain us is when you talk to your patients about the knee replacement. So how do you kind of explain it to them? Because for many patients, the knee replacement, especially the word robotics, might be a little little, intimidating. So how do you explain it, that what actually happens in robotic knee replacement?
Yeah. Again, in the last, we have robotics into joint replacements for almost 6 years now. When we had it new, so a lot of patients used to think it is a humanoid robo that we see in some sci-fi movies.
Yes.
And some humanoid robo is going to come in and operate.
Yes.
It's not a humanoid robo, it's a machine which is available.
Yeah.
It's a machine where we scan your joint in different ways. And after that, after a certain point of time, we will use the machine's help to get the correct cuts done. So fortunately that's done. Majority of the patients do see the robo inside the theater, because we do these surgeries under spinal anesthesia where the patients are awake. So they can see the robo, they can see what adjustments we are doing, what things the robo helps us. So that's how we counsel the patient. It's not a humanoid robo that's come, it's a technology, it's a tool in my hand. I am the ultimate operating surgeon and the robo helps me to go in the right way. The robo doesn't operate. So now again, in the last 1 year or 2 years, patients have understood that, and the questions
now they are quite
changing.
familiar with the entire process.
Correct.
Right?
And strengthening of muscles before the surgery is very important.
Correct. So if the
He
patient
had advised me to go through a physiotherapy exercise
Before
to strengthen the muscles.
pre-operative.
So at that time I used to wonder why physiotherapy before surgery.
Before surgery.
But then the muscles around the knees, if they are strong, the recovery takes
Takes faster.
Recovery is faster, I think.
Correct.
So that may
those
understood.
patients who are waiting for surgery, see, this is not a
Emergency.
surgery.
It's a very
So
planned
majority
elective
of the
surgery.
patients are going to wait for minimum 15 days to 3 weeks before they go ahead for a knee replacement.
Yes.
So that 15 days to 3 weeks, if they utilize for increasing the muscle strength of their quadriceps primarily,
It works in their own favor.
it works in their favor and it leads to a faster recovery beyond their expectations.
True.
And moreover, being a vegetarian, non-veg people, they can strengthen their muscles with the
Protein
by
intake.
eating protein intake, chicken and eggs and all that. But that I could not do. So exercise, physiotherapy was the only thing, and diet, vegetarian diet,
Which
by
you
I
followed
could
very
come.
strictly. So what are the things that you could not do before, but you are able to do now?
Now, of course, I can, as I told you, one more thing I wanted to tell, like, during the physiotherapy, the physiotherapy used to take me down in the parking area to walk with me. And at home, she had told me that you will have to use your walking stick. Walking stick.
Acha,
a
walking
walker.
stick.
I somehow avoid using walking stick. I somehow feel that no. Walker I used for just 1 week. In the house I walked with walker, but after that, after 7 days, I walked without any support.
Lovely.
And that gave me a lot of confidence.
Correct.
Yes.
So that is possible because of the pre-operative physiotherapy. Because her muscles were stronger before surgery, so the recovery was easier without a walking aid.
Because once you take the support, somehow you depend.
Yeah. Psychologically, you start depending
so
on
that's what I would like to tell people who are going in for surgery. Like after the surgery, there's a lot of depends on your own mindset.
mindset.
Correct.
You have to be positive and feel as independent as possible. So avoid using all the supportive methods.
And believe in yourself that you can do it.
And that's why even after surgery, earlier, when it was painful, I used to take support, whether I'll be able to walk. But after the surgery, after I started becoming normal, my daughter told me, now you check your bucket list. Now tell me what all you want to do. I said, I want to travel. So she booked my tickets and I went on a solo trip to Ayodhya, Lucknow, Allahabad.
Lovely.
And with Avina Travels. And I was happy.
So
All the
solo
time
trip
behind
done.
my mind I was thanking God for having given me the chance to travel, and of course thanking the doctor who enabled me to come to this stage.
That's what I said. You need to enjoy your life.
Yes.
So now you are in a phase of life where your responsibilities are over.
Are done. Yes.
And then only because you are having pain in your knees or in your body, you are not able to travel is not a very good idea. So get your knees replaced and enjoy your life as much as you can.
So if I have to ask you, ma'am, describe your journey from pain to complete healing, how would you want to describe it?
It sounds magical, no doubt, but it's not a one-time magic one. It's a process from pain to relief from pain. It's a process which involves a lot of things, like involves the right, choosing the right doctor.
Doctor begins by choosing
Begins
the right
with
doctor.
choosing the right
Yes.
doctor, which I have very fortunate to have Dr. Agashe as my doctor. Then trusting his directions, whatever
Yes.
directions given by the doctor, you have to trust in them and then follow them. No doubts, don't ask questions. Their doctors are telling you, like, God can't come himself, so he sends doctors
True.
to guide you. So you can't show distrust to God. So why distrust? Why should you show distrust to doctors?
Correct.
So trust the guidance which they give,
Correct.
and have full faith in all the what I say, post-operative treatment and all, physiotherapy and all
The
that.
process.
Have faith in the recovery which is going to take
Yeah.
place.
Yeah.
So once you have faith that you are going to recover, you will recover.
You will recover.
And of course, have a positive mindset.
Have a positive mindset. Sir, how do you describe your experience working, so close, working on a very close patient relative?
As you said, you need to compartmentalize, treat the patient as a patient when she is or he is coming to your clinic or in the operating room. When you go outside, then they are your relative, your acquaintances, your friends, your otherwise known people. Second part, as I think I have followed in the last 20 years, is as far as knee replacement is concerned, is stay away from their post-operative recovery period
Yeah.
as a relative. Be there with them as a doctor.
As a doctor.
So when you are doing your rehabilitation part, as I said, even the physiotherapist should preferably be not from the family, not from a very known background,
circle. Yeah.
so that she can or he can push the patient to do the correct rehab. So I don't go and see my post-operative patients in the first 3 weeks, particularly those whom I know, because that is the time when they are going to tell me, Abhijit, it's painful, and I ask the physiotherapist not to do it.
No.
So you stay away from that. Let the physiotherapist do the rehabilitation program.
So bring out, take off the personal touch
Correct.
from that angle.
Correct.
of it.
So take out the personal touch in the rehab program
part,
where
yeah.
they are doing the rehab, and that's the more important part of your recovery process.
Recovery journey.
Because the patient's mind is like a child, at that time. The moment the child sees the mother, it starts complaining.
Yes.
Ye ho raha hai, wo ho raha hai. So the
Yes.
moment the doctor comes there,
Ah.
then they'll say, no, nothing is happening, this is paining, that is paining. So they might start that. So
So stay away from the recovery
away.
part.
It becomes
Stay away from
stronger.
the recovery part.
Take the
as
feedbacks from the therapist
Yeah.
rather than you going and meeting every time.
True. So, ma'am, what message do you have for all our viewers out there who are, due for a surgery, have been postponing it with maybe because of multiple reasons like fears or something like that? What message do you want to give out to them?
My message from my own experience, I would say that the moment you realize that there's some abnormality in your knees or whatever, which part of your body, and when you consult a doctor and whatever advice the doctor gives, try to think over it. It's not just advice given in the air, There is something, and you may not notice what is happening inside your body, but the doctor knows. So the degeneration, the regression which is taking place, it is happening. So you should be cautious. And then going for the surgery, there is no problem, because nowadays the advancement in science is so much. We are lucky to live in an age where there is so much of advanced technology in medical field, and doctors are also efficient. So you choose the right doctor, efficient doctor, follow his advice, and be positive minded. Never say that I will not get it. The moment you say I will not get cured, finish. You will never get cured.
True. So that's about that. And what would be a message from Sir to all our viewers?
See, if you are in the late stage of arthritis, there is no point in postponing your surgery unnecessarily. At times, there are patients who are not in that bad state and still want surgery. In that case, I have to do a reverse counseling that, okay, you have pain, but there are other ways of curing your pain. Surgery is not required. But majority of the times, patients do come to me where their joints are really bad and they are trying to postpone their surgery. Postponing your surgery unnecessarily is not going to help. In fact, it is going to deteriorate your conditions, because as I previously said, I cannot change your muscles, I can change your joints. So in those cases, doing pre-operative rehabilitation or pre-operative physiotherapy helps a lot. So if you have been advised a knee replacement or a hip replacement, Do not try and postpone it indefinitely. Yes, there will be a few instances that there is something coming up in the family, and then there is no hurry. So you can finish that off and then go ahead for your surgery at the earliest.
So that's about that. And before I, close this podcast for the day, so I want to ask ma'am one last thing. One line for Dr. Agashe. About him. About your surgeon.
About my surgeon.
Not your best friend's son.
He has healing hands, that is for sure. He has the God gift of healing hands. He's blessed in that way, as a good doctor. And he's the one who really has empathy for the patients. Like, I remember after the surgery, when I was in the hospital, he used to, though there was some function at home, I think there was a puja, still he made it a point to leave that function and come and see me. So that is very important, psychologically for a patient. It's very important. Otherwise, I've heard about some who just don't come and see the patient at all. So your patient feels, lost. So the moment the doctor comes and sees, even if he comes and sees you, that's enough. So much of moral support you get, and that he does.
Lovely. Thank you so much.
God bless him. God bless him all the time.
Thank you.
Yes. Thank you so much to both of you for coming on this podcast. It was lovely having this discussion, and especially a big thanks to you, ma'am, that you gave us all this information, and this experience hearing right from you was amazing. Thanks to sir for giving us this time, cancelling, postponing a few surgeries, and so thank you once again for coming on Sahyadri Health Talks.
Thank you also for giving me a chance to express my gratitude to my surgeon, which otherwise I would have to go home and tell. That becomes very artificial. This I've got a chance to tell the public that how much I owe to him.
Oh, lovely. The pleasure is all ours. Thank you. On that note, this is Dr. Tushita signing off, Sahyadri Health Talks.